Medications cannot cure lifestyle diseases like a fatty liver or cirrhosis. However, ultrasound scans and blood tests help to diagnose liver diseases very early, and by identifying the anomalies in the lifestyle and correcting them, it is possible to prevent destruction of the hepatocytes or liver cells, prevent the deadly diseases like cirrhosis, portal hypertension, esophageal varices, cancer, etc., and regain liver health. In most chronic liver diseases patient, it begins with the excess fat deposits in the liver and the development of fatty liver. Latest studies shows that insulin resistance, which is the cause for the majority of diabetes, and consequent high insulin levels in the body, also known as hyperinsulinemia, also leads to fatty liver. In type 2 diabetic patients, fatty liver will develop even before glucose levels start rising or in the pre-diabetic stage itself. Most important to note that insulin injection taken by type 2 diabetic patients and many medications that promote the increased production of insulin can promote progression of fatty liver disease. The first stage of fatty liver is the inflammation of the liver due to fat deposits. In the second stage, the inflammation increases leading to damage to liver cells which cause the SGPT, SGOT, bilirubin, etc. to increase. When there is more damage to the liver cells, the liver starts to shrink, and this is called cirrhosis. In patients who have inflammation and cirrhosis, there is more chance of developing liver cancer. Most liver diseases come under the classification of lifestyle diseases. Lifestyle diseases cannot be cured with medicines, nor can recurrence be prevented with medication. But modern medicine diagnostic methods can help identifying them very early. We shall see how with lifestyle correction it is possible to reverse liver disease like fatty liver, cirrhosis along with diabetes, insulin resistance and consequent hyperinsulinemia. Health tips are not the focus here. Rather, the efforts on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigation to assess the impact of disease on different parts of the body, available treatment options in modern medicine with the benefits and limitations. The goal is to help you to understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When we try to understand the diseases of the liver, we should know the basic structure of the liver and the functions of the liver, etc. When we consider the liver, it is the biggest internal organ of the body. It comes around 1.5 kg. And it is arranged in the internal structure is arranged, the basic unit is the hepatocytes. And it is arranged in a lobular fashion. And this there are specified cells called Kupffer cells as the immunologically acting or protecting cells in the liver. And liver has a peculiarity in the circulation, the blood supply itself. That is, it has a hepatic artery, portal vein, bile duct, and hepatic vein. And it is the blood which is collected from the intestine. That is after absorbing the nutrient after digestion, the blood is the nutrient are coming into the blood circulation. That enters the portal vein. And this is coming into the liver, and it is divided or distributed in the liver cells in the hepatic lobules, and then it is after this the liver is processing all these things and released into the systemic circulation, which is taken by the right side of the heart through the inferior vena cava. That is the flow of pattern in the liver. And then when we come to the functions of the liver, it is a station for the metabolism, that is the production, it is a production unit actually. It is the digested nutrient is absorbed into the liver, and the carbohydrate in the form of glucose and fructose, and the fat in the form of triglyceride, and protein in the form of amino acids. Then the liver is producing the protein when it is digested into amino acids, and then liver is producing from the amino acids which is absorbed to protein, which is not what the person is needing. So around 500 items is made continuously in the liver for the purpose of the activities of the human body. And this from the glucose, it is producing glycogen, that is a storage form of the carbohydrate in the human body. And this triglycerides, if it is excess glucose is there, which is after production of the glycogen, it will be stored as a fat in the adipose tissue. And the liver is producing cholesterol also. Cholesterol is needed for many activities, especially the production of hormones, steroid hormones, and the sex hormones, etc. Cholesterol is needed. Even the bile acids that is needed for the digestion, cholesterol is needed. And this is produced by the liver. Actually, the major cholesterol production unit is the liver cells actually. And it is needed for, actually the vitamin D is produced in the skin from the sun rays, that is ultraviolet rays, by using cholesterol. And it is acting as a pro-hormone actually, or it is a type of hormone actually. Vitamin D is a pro-vitamin or a pro-hormone. It is coming to the liver, and liver convert into a more active form, and finally the kidney convert into the most active form. And many proteins like thrombopoietin, which is a protein hormone actually. It is controlling the production of the platelets. That is very important for the clot formation and preventing bleeding, etc. And its action is mainly in the bone marrow. Bone marrow is the production unit of all the blood cells, like RBCs, WBCs, and the platelets. And this protein thrombopoietin is very important for the production of this platelet actually. Next, it is making clotting factors. Clotting factors, that is also very important for the bleeding to not to occur, that to prevent the bleeding from the, that when this clotting factors is deficient and the thrombopoietin level is gone down and the platelet is gone down, that is the reason for the liver patients at the end stage, the bleeding occurs, especially the vomiting of bleeding or vomiting blood, or even the dark colored stool when there is, it is either this from the esophagus is bleeding into the stomach and getting denatured and darkened stool, one of the symptoms. And also if they are taking too many medicines, the ulcer in the intestine can also bleed. That also will produce dark stool. Dark stool is a sign of internal bleeding into the intestine. Another important hormone which is produced by it's a hormone, it's the angiotensinogen. And this is very important for the pressure control actually. And another important function of the liver is the detoxification of the toxins. This is alcohol, we all know. And all the medicines which is detoxified, almost 90% of the medicines we take orally is detoxified in the first pass metabolism, most of the 80 to 90%, and only the 10% which is coming to the general circulation, which is liver is missing out. It is actually giving you the benefits of the symptomatic relief if you are taking this painkiller or any medicine which is when it is passing through the liver, almost 80 to 90% will be destroyed. And then liver has an important role in digestion, the bile production, and which is stored in the gallbladder, and it is released, the bile is released according to the food intake. And the gallbladder diseases, actually it is a reflection of the ill health of the liver itself, because the liver is producing the bile, and if the bile is not in the correct composition, the liver gallbladder will be affected in the form of stones. It will be deposited in the stone, the crystallization take place and it makes the stones. Or if it is the chemical nature is not tolerable for the gallbladder, that can produce the polyp or the cancer also. Next, what are the predisposing factors, or what are the cause of this liver diseases? There is definitely one familial tendency is there. If the parents having liver disease, fatty liver, liver cirrhosis, etc., you can go into liver. The diets children also can get. Next is the lifestyle factors. The most important, we all know that the alcohol consumption, it can damage the liver. And also almost all the drugs which can damage the liver. That is why if you are taking many medicines, you are in between liver function is tested. The steroids, the cardiac medications like amiodarone, even the cholesterol medicine. It is very commonly taken statin. Statin also is blocking actually it is straining the liver because it is blocking the production of the liver, the cholesterol which is produced by the liver. So it is actually, in the latest understanding, is that those who are having fatty liver and the liver problems should not take these statins because it can damage more strain on the liver. And also the medications like antibiotic, tetracycline, tamoxifen, one of the chemotherapeutic agents, and almost all the chemotherapeutic agents can produce damage to liver. And there are specific infections, especially this hepatitis B and C. And many autoimmune diseases can affect negatively on the liver also, especially this familial liver cirrhosis and liver failure. This brother or the father is having getting liver cirrhosis and early liver failure, and it can also run in the family. That also the latest finding shows it's an autoimmune disease of the liver. It can be faster deteriorating, or it is a slow progressive. And another hepatitis, it can be because of the autoimmune hepatitis and also autoimmune cholangitis. Cholangitis means the bile duct is getting affected because of the autoimmune disease. This also can run in the families. And then the gallbladder stone and the polyp, that also is a part of the, it's considered as a single unit. Liver and the gallbladder is considered as a single unit. If the liver is affected, then definitely gallbladder is getting affected. And another important thing is the pancreas. Pancreas and liver also is very closely connected. And in type 2 diabetes, the pancreatitis can be, that is chronic pancreatitis, the amylase and lipase can be increased, and also the fatty infiltration of the pancreatic cells also is very common. And in type 2 diabetes, the insulin level will be very high. And that means the pancreas is overworking. And insulin is producing the problem. It's actually this insulin increase and the type 2 diabetes, and it is always comes with the fatty liver also. And when we are usually when we treat type 2 diabetes also, we are giving insulin injection. There is already hyperinsulinemia is there. And on many of the medicines which is used for the type 2 diabetes, the oral tablets also, by acting by the increasing the production of the insulin. And you are eating too much of carbohydrate. That is why the diabetes is the first reason for the diabetes is that you are eating too much of carbohydrate. And you are taking, if you are, instead of reducing the carbohydrate intake, you are actually promoting the pancreas to work more. When you are taking the carbohydrate and fat more, the pancreas has two functions. One is hormonal function and the other is the digestive function. The digestive hormone which is producing by the pancreas also has to be, pancreas is pushed to make more amylase and lipase, etc. So that is making this pancreas also inflamed. That is the reason for the chronic pancreatitis in many of the patients with the type 2 diabetes, and along with that there will be fatty liver, and when it is progressed it is liver cirrhosis and so on. Next is, it is very connected with the intestine. It's a gastrointestinal digestive system. Liver is a part of the digestive system. So the diseases of the gastrointestinal tract like gastritis, colitis, IBD, IBS, etc. also will give an impact on the liver. And it is actually when the inflammation in the gut is there, the leaky gut syndrome. That is, the undigested food also get into the bloodstream, and also this bacteria, the gut is full of bacteria like E. coli and so many other organisms are growing there. They are also getting a free entry into the liver, into the blood circulation, in the portal circulation, and this blood is actually portal circulation. It is gone and released into the liver. So all the impact of this bacteria and this undigested food all comes on the liver actually. So that is one of the reasons for this cholangitis and this liver hepatitis and cholangitis. And so that also we should be very careful about all these diseases. The food you eat also is very important actually. Then it is a metabolic syndrome. It is the liver, fatty liver will be there with the metabolic syndrome. Metabolic syndrome in obesity, diabetes, dyslipidemia, and hypertension. That is the primary factors in the metabolic syndrome. And definitely there will be, along with that, fatty liver will be there. And snoring and this oxygen deficient. And snoring means you are not taking a breath properly while you are sleeping. So it can also be again an impact on your systems. Next is many of the factors is nutritional deficiency. One of the main hormone vitamin which is needed is choline, and also vitamin B12, B6, etc. is needed, and its deficiency. Actually, the latest study shows that the connection between homocystinemia. Homocysteine is amino acids, but it's methionine and homocysteine is amino acids. It's essential amino acids actually. Its this metabolism is blocked. Liver is the center for the metabolism. No? That is one of the reasons for this heart disease and even the arthritis, varicose vein. And so this homocysteine is increased in many of these cases. And it is all connected with the choline and many vitamin deficiencies and the functioning of the liver itself. The liver is the place where all these activities is taken place. If there is a deficiency of insulin or deficiency of vitamins, it can be definitely, it will damage the production of these vitamins and minerals and even the proteins and many essential proteins and essential fat, etc. will be blocked. That is what is happening when the vitamins are deficient. That is affecting the liver. Next is toxins in the food. For toxin entering the body, either food, water or the air, all comes finally into the liver for detoxification. We are taking so much of toxins in the food itself in the form of food additives like color, preservatives. This all impact the liver health actually. Okay. And next and another most important thing is the burden medicines creating on the liver actually. All the medicines which is going, when what you are taking orally is directly going into the liver, and if the liver is already, fatty liver is there or liver cirrhosis is there, then the most important thing is reducing the medication itself, because it is all toxins to the liver. Next we come to the liver diseases. There is acute liver disease and chronic liver disease. Acute is usually the infection like hepatitis A or a toxin which is affecting the liver. It can make the liver failure in the faster progression. That is called acute liver disease. Even this autoimmune liver disease can also appear as an acute form, because it can go into a liver failure within 3 weeks or 4 weeks. So such things are called acute liver disease. Next is the chronic liver disease. That is chronic mainly because of the medication, nutritional deficiency, and the alcoholic fatty liver disease. As a AFLD or NASH or NAFLD, that is non-alcoholic fatty liver disease, and then it is when it is progressed to called it is hepatitis. Initially it is fatty liver disease, then it is fatty non-alcoholic steatohepatitis. In 2023, there is a new nomenclature family came into the medical field. Actually, it is not generalized. It is commonly used, but it is diagnosed as a metabolic dysfunction. The primary cause of this fatty liver and liver cirrhosis and liver function is the metabolic. So it is called a metabolic dysfunction associated steatohepatitis disease, that is MASLD. Maybe within the next few years it will be commonly known as NASH, will be converted to MASH, that is metabolic dysfunction associated steatohepatitis. Previously non-alcoholic and alcoholic. Now it is metabolic associated dysfunction or it is metabolic and alcohol associated liver disease. Next, when we come to the symptoms, what are the symptoms or how we diagnose it? For the diagnosis, it is first is the symptoms which are happening. The liver will say complaint or make you symptomatic only when in the late stage. Usually there will not be, the most important thing is pain. Pain, the liver is not usually showing much of the pain. And the swelling we cannot see because it's an internal organ, we cannot see the pain, the swelling. So the protruding tummy, if the liver is sitting inside the abdomen, so if the abdomen is protruding, that is the first sign of the symptom, the disease, and first symptom actually. And next you can check your weight. If your weight is excess, if height minus 110, that is the ideal weight for you. And if you are so muscular and doing 3-4 hours of hefty exercises to build up your muscle, then you can be taken as height minus 100. That is, if you are 175 centimeters, if you are very healthy and doing so much of exercise, you can be up to 75 kg. But if you are not doing much exercise, you are a techie, you are doing only half an hour to 1 hour exercise and all, then you should take it as your ideal weight should be considered as 65, not 75. So if your weight is excess, you should consider your liver can be affected. Then next is, what is the investigations? The blood is the primary mode of investigation. So blood test, LFT, that is liver function test. There are 8, or depends on the laboratory, up to 12 parameters they will be checking. And it can be, if it is increasing, that if there is a change, then you should think that it is a hepatitis is there, the liver is getting damaged actually. Then fibro tests are there. Then inflammatory markers, if inflammation is high, the inflammatory markers like CRP, blood count, etc. can be increased. And autoimmune markers like LKM antibody, ATA antibodies, and AMA. And tumor markers, if the cancer, you can look into the tumor markers. The alpha-fetoprotein is one of the direct marker. And also the other intestinal cancers can give secondaries in the liver. In that also CA 125, CA 19.9, that is a marker for the pancreas, etc. can be increased. And when we come to the scan, we should understand that the scan is the earliest symptom. Actually, the fatty liver grade 1 is the earliest symptom. Only after that, only the enzymes, SGOT, SGPT, etc. will rise. Now it shows that more than 30% of the liver oleum is fat. In that stage only the scan will show you that is fatty liver grade 1. So we should understand that we should not ignore the fatty grade 1. It's only early stage. Don't take it lightly. It's already when you are in the stage of fatty liver grade 1, more than 30%, 1/3 of the liver is filled with fat actually. So then is the definitely fibroscan is there. So that shows the fibroscan is the how much damage scar tissue is becoming made in the how much of part of the liver has become scarred actually. That is cirrhosis, indication of the cirrhosis. And CT and MRI, and next the biopsy. But nowadays we try to avoid the biopsy. It is not needed really. The gold standard of diagnosis is biopsy and how much fatty this and all is there. But we can, because liver is already from the blood and the scanning, we can know that what is the sickness or the extent of disease. So we can, most of the case, we can avoid a biopsy. And for the end stage of the disease, like you are using this MRCP, ERCP, that is all invasive procedures. So with the fibro test, it contains around 5 biomarkers and all the other biomarkers. We can avoid this sort of many of this diagnostics test which is invasive. When we come to the complications, what is the problem with the fatty liver grade 1 or grade 2 or grade 3 or grade 4? What is the problem with the liver disease? What will happen for the patient if they are ignoring it? So the liver disease which can progress if it's fatty liver 1, 2 and 3 and 4 like that, and also cirrhosis. Cirrhosis also grade 1 fibroscan shows the cirrhosis or fatty, the scarring level. It can also progress like 1, 2, 3, 4 like that. And what happens after fatty liver to liver cirrhosis, and what will happen with the liver then? The liver is fibrosed and the scar tissue is dominating. The portal hypertension, the blood pressure inside the liver will increase. Why? Because the liver cannot, the blood vessels are getting blocked because of the scarring. So liver will find to from some other, the blood coming from the intestine and all, portal circulation, it is not able to travel through to the heart through the liver. It is actually traveling through the liver to the heart. Inferior vena cava, then to the heart. But when it is blocked, the body will be trying to find out alternative bypass for the this blood in the liver to go through this in the esophagus or some other, even to the periphery or into the deep esophageal veins actually. That is manifesting as the esophageal varices. Actually, it is the body's own corrective measure. But if that breaks and bleed, if it's a very soft area, no? So there is a chance it can bleed. So in that case, you can make to stop the bleeding, you can do the cauterization and all. But in general, what is happening in this modern medicine, most of the doctors are doing, to prevent this bleeding, they are doing banding and all. Actually, it is a protective mechanism of the body. They are finding it bypassing the liver because there is no circulation, because this blood has to reach the heart anyway. So we are actually, by doing that, all this banding and sclerotic, without bleeding, if you are doing all these things, it is actually the body's own mechanism to correct or to adjust with the problems we are actually restoring. Then if this esophageal varices, if it is bleed, hematemesis, and because the liver is the clotting factors and the platelet is actually, the platelet count is controlled by the liver. When the liver is failed, the clotting mechanism will get failed. That is the reason for this hematemesis occurs. And then this albumin and the protein is not sufficient. The albumin is not sufficient. The edema of the whole body or the leg, initially in the leg and then the whole body, and then finally the ascites, the abdomen will distend because of the fluid collection, not because of the fluid collection in the abdomen also. And finally, this hepatic encephalopathy, because of these toxins accumulating in the blood like ammonia, the brain function will be deteriorating, and the patient not able to, the cognitive powers will be reduced. And of course, the immunoglobulins, the immune system functioning is deteriorated, and the frequent infection. That is the end stage of the liver problems actually. Next, we will consider about the treatment. When we take the treatment of the liver disease, there is no medication for correcting the liver, especially fatty liver. And for the infections like hepatitis A, there is not much medicine. There are some antiviral medications are there. But the problem with the antiviral medication, this antibiotic, that is when cholangitis occurs, antibiotics is the solution. The problem is also making the liver burdened. So only medicine which is at least supportive is the bile acids like urodeoxycholic acid. That is actually reducing the function, the burden on the liver to make the bile acid, because the liver is already sick. So you are supplementing the bile acids. But that also for a long time it can also damage the liver. That is what the study shows. So there is no effective medication for the liver problem. Only some, if the portal hypertension is there, there's some antihypertensive like this beta blockers like propranolol is given. And varicose veins ligation in the esophageal varices, ligation and cauterization, etc. is done. Actually, in the absence of any bleeding, such things are actually damaging the body and creating more trouble actually. But unfortunately, such things, that is all it's a part of the established treatment, and it may, that all started before we are having much understanding about this, how it is produced around 30-40 years back, and it is now also continuing. But now we know more about, and I think it will change. And then in the near future, such surgical procedures will become obsolete actually. And maybe it may take, I don't know how many years, but within 5 years or 10 years, depends on the awareness created among the patients itself. So every patient, when they are advised to do a banding or endoscopic banding or sclerosis without bleeding, they should definitely take a second opinion about what is the complications of this and what is the advantage for undergoing this type of operations. And the patients, because now everything is there in the net, and you can find out the complications also, what is the advantage and what is the disadvantage, you should check about it. Most of the patients with fatty liver and the liver disease, there will be diabetic, hypertensive, dyslipidemia, and so many other problems will be there. But all these medications, the limitation is all these medications actually increase the workload of the liver. So because the every medicine which you are eating or even injecting will be coming to the liver for detoxification. So when the liver is already on weak, it's reducing the medication is the most important thing. Next, just like for the kidney, we have a dialysis machine is available. It is so we can do it. But for the liver, there are so many attempts to make an artificial liver and liver dialysis, etc. But it is not effective. Next, the final thing, if the liver is failed, is the only thing is the liver transplant. So there are so much problems compared to renal transplant. Is much more complicated procedure. So if the donor, the kidney, there are two kidney, one can be donated, and also the recipient, the other kidney, their kidney is not touched. So the surgery is very simple, taking one kidney and implanting it in the lower abdomen. And surgery is only that connectivity on this thing. The other thing, the donor, it is removing, and two kidneys is there, one is given. So it is not that complicated. But in the liver, if the donor, 60 to 70% of the donors, if it is a live donor transplant, almost 60 to 70% of the liver is taken. And for the child, it is only 20% is needed. So the risk for the donor is very high, and also for the recipient, the liver, it is removed. Then this part is fitted. So it is very high risk compared to the renal transplant. That we had to understand before going for any transplant. We had to think over all these complications, and also if it is when those who are donating after death also should understand that the parents donating the organs of the children also should understand that while you are donating, the patient is not dead fully. The patient heart is beating, and only the brain death also is there, and it is also brain death is not complete. So the patient, this donor, the patient can feel the pain. That is why it is removing under anesthesia. So you are removing the organ with the beating heart for the donor, even in the cadaveric. So it is not a complete dead person. Complete dead person cannot be none of the organ transplant, only the corneal transplant. The eye corneal transplant is done in a totally dead person. Otherwise, the patient's all the other organs is removed while the patient's heart is beating. So that also should be considered when you are donating the organ and also accepting the organ. So most important is protect your liver, and don't think of going for this organ. If you are careful, you can definitely protect your liver. Why should we think of such things? And even I am after accepting, even it is a live donor or a cadaveric transplant, you had to take this immunosuppressants, maybe 3 or 4 immunosuppressants and medications lifelong. So that will decrease your immunity, and thereby it will increase the chance of infection and the cancer, etc. also. Now we know that there's no treatment for liver disease basically. It's only some supportive measures or symptomatic measures the modern medicine can provide. And this transplant, liver transplant, are all having its own so much of complications and problems is there. So what is the real solution? Most of these diseases affecting, especially mostly we are discussing on the fatty liver and the liver cirrhosis. So it's because of the lifestyle. So you should correct the lifestyle. That is the most important thing. Find out in the early stages, try to find out by doing the test. And when there is a grade 1 fatty liver itself, try to do some exercise and try to avoid junk food, the toxins, which is with the food with food additives like color, preservatives, etc. And reduce your calorie and fat intake. Everyone thinks that this nuts are okay. And nuts, generally people think that this cashew nut or this pista, badam, etc. is healthy. Actually, all these nuts, most of these nuts is having very high content of omega-6, and there's no omega-3. Only this walnut contains some omega-3. All the other nuts which you are eating is containing high omega-6. That is inflammatory. And also those fatty liver, this fat is already excess. And that if you are taking the omega-6 fat, it is inflammatory also. So the damage will be higher. And the carbohydrate, and reduce the carbohydrate and fat in the form of not only the oil, fries and oily items, you avoid the nuts also. That is very important. Next, check the blood parameters. Also see that frequently, at least once in a year, as a part of the health checkup, do not only the blood parameters, do ultrasound scan of the abdomen. It will give a lot of information, not only from about the liver, kidney, pancreas, and the genital organs, etc. You get a very clear idea. So make it a habit of doing ultrasound scan. It doesn't have any side effects also. But if you have CT scan and MRI, it is expensive, and also it has radiation exposure, etc. So don't go for that, but do an ultrasound scan. And if you are, so there is no meaning in just doing the health checkup and ignoring the lifestyle correction. If there is any problem, if you are finding it, you see that is corrected, and repeat the abnormal test at least after 3 months and see that you are in the proper health. And those who are not able to do the lifestyle correction, because if you are already on medication for diabetes, hypertension, heart disease, etc., you will not be able to do the food control. Or if you have an arthritis, you may not be able to do the exercise. In that patients, they may need lifestyle correction with the clinical support. So you need real support for how to find out which is the ideal food for you, ideal exercise for you, and see that with the monitoring, everything is getting corrected. In short, first, all liver diseases from fatty liver, cirrhosis, liver failure to liver cancer are considered lifestyle diseases. Second, with current modern diagnostics, it is possible to identify such diseases at an early stage and identify the associated lifestyle issues and correction to protect the liver. Third, gallbladder stones, polyps, cancer, etc. are caused by fatty liver and poor liver health. The variations in bile fluid made by the liver to aid digestion is the cause of gallbladder stones, polyps, gallbladder cancer, etc. Fourth, excessive toxins, lack and excess of nutrients are the main cause of liver disease. The liver identifies as a toxin anything other than it's a nutrient. Even medicines and also an excess of nutrients. Biological agents like virus, bacteria, etc., alcohol, medicines, excess of fat and carbohydrates, chemicals like artificial tastemakers, preservatives, weedicides and pesticide residues, etc. All of these can result in damage to the liver cells. Fifth, initially only relatively weak symptoms like fatigue, abdominal gas and small abdominal pain are felt. Only after liver damage has advanced, we see symptoms like facial darkening, edema, ascites, vomiting blood, severe discomfort, and mental paranoia, etc. occurs. Sixth, when blood test and ultrasound scans help diagnose early stage disease of liver and gallbladder, the best and the simplest approach is to identify the lifestyle related anomalies and immediately take steps to correct them. Seventh, the liver has the primary responsibility of detoxifying all toxins that enter the body, either through food, air, or even the skin by metabolizing it. Eighth, when the liver becomes diseased, it is most important to reduce the workload of the liver and allow rest. This can be done by preventing toxin entry into the body, helping expel toxins already accumulated in the body and simultaneously providing adequate nutrients to help replace damaged liver cells with healthy new cells. Ninth, the liver sees almost all medicines as toxins. Medicines increases the workload of the liver. This is why medicines often effectively affect the health of the liver. 10th, Those taking medications for lifestyle diseases like diabetes, hypertension, cardiovascular disease, etc., should understand that they have to correct their lifestyle to overcome both the lifestyle disorders and the need for medication to protect the liver from fatty liver, cirrhosis, and cancer. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulations can help achieve reversal of disease process, attain desired body composition, and normalize blood parameters based on the patient parameters. Effort is directed to provide optimal nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advised surgery for lifestyle disease like diabetes, hypertension, heart disease, arthritis, autoimmune disease, cancer, allergies, etc., can prevent progression of diseases. To some extent, reverse the damage and come out of most of the medications within a month and avoid surgeries, provided the person is able to correct lifestyle before the organs are irreversibly damaged. Next, we will see what is the result of clinically supported lifestyle correction for this patients with liver problems. First, we will discuss a patient who is 49-year-old, height 182 centimeters and weight 81 kg. He is not that overweight actually. And he is having diabetes and fatty liver. And his HbA1c is 6.8. And his insulin level is also high. Usually these patients with diabetes and fatty liver, the insulin level also will be high. And it is 28 versus insulin level. And his amylase and lipase is high and cholesterol is high. That is also, dyslipidemia is also very common with it. And he is having some liver, kidney problems also. GFR is reduced, uric acid is high, and SGPT, SGOT is increased. And this autoimmune antibodies, AMA is high, and also his CIFRA 21.1, that is a marker for lung cancer actually. We look into, usually for the, before clinically supported lifestyle correction, we do a detailed study, and this patient is asking for screening for the lung cancer also, because he was a smoker, and now he's reduced it but not completely stopped. And he's not a alcoholic, only occasional alcohol, once in a month, 1 or 2 peg. Even with that, and he's not obese also, even with that he is, because he is having fatty liver with non-alcoholic hepatitis. So here the reason is actually maybe an autoimmune disease which is affecting, because AMA is generally considered as a thyroid related, but we are seeing many patients, the thyroid function will be okay, but some other autoimmune disease will be there, and they will be having AMA is high also. Then what was the result for this patient? So he was able to reduce his weight from 81 to 76 within 75 actually within a month. And his HbA1c has come down to diabetic use. It's come down to 6.1 from say 6.8 to 6.1 within a week itself, and also his insulin level also came down with the normal. It was initially 28 and it came to 11 actually within a week itself. And SGOT and SGPT also came down, and to within a month his liver parameters has come down, and even his HbA1c within a month it is 5.6 only. So that is 6.8 with the medicine and 5.6 without medicine. And that time he was able to reduce the weight also around 5 kg weight reduction also he's gained. And fat, everything. I'm not going into the detail. And even the most important thing is this CIFRA on 21.1 is that is a cancer marker that also came to normal. And that is the thing. So basically, we'll be able to bring the parameters within a month itself. But the autoimmune antibodies didn't come to normal within a month. It usually takes more time, and also more weight reduction and more support is needed to bring down the immune system corrected. We'll take one more example. This is a lady, she's 66 years and 161 centimeters and 58 kg is the weight. She's having diabetes, hypertension, dyslipidemia and thyroid disease, hypothyroidism for the last 21 years and on medications. She's taking so many medicines actually. And for this thyroxine, olmesartan and medoximil for the hypertension, rosuvastatin and duloxetine, epalrestat, because she's having so many discomforts also. And diabetes, hypertension, along with that chronic liver disease stage 3, that is fatty liver 3, and also the fibrosis also is there, and CKD, muscle cramps and neuropathy, and also this actually some of the medicines are for neuropathy she's taking, and arthritis also, so many problems actually. And diabetes, she's taking acetagliptin, metformin and empagliflozin, so many medicines she is taking. So this patient, what was the result actually? Initially she is having, the scanning showed that fatty liver grade 3 and the fibrosis level 4 fibrosis is there, and the blood parameters, her insulin level is high, HbA1c level is, the reasonable control is there, 6.4 is only, that 6. Yeah, and the insulin is 36.6. So sodium level, her kidney is also affected, so sodium level is going down, and anemia is also there, and here also AMA is high, so many abnormalities. But the thing is, with this diabetic medicines, we stop at the first day itself, because it's already she's having excess insulin, so there's no need for insulin or any diabetic medicine actually. This type 2 diabetes, actually there's no need for it. If you are taking medication for the diabetes type 2, you are actually inviting more trouble. This patient, within a week itself, and the 8th day itself, her insulin level came down to normal. And this HbA1c came down to 6.2. And by the 30th day, her HbA1c came, 30th day it came down to 5.7. And the 60th day it is 5.4. See, with the medicines she was having all these problems. And diabetes, hypertension, everything. And by the 30th day, all the medicine except the thyroxine, she's taking, her dose is reduced to 25 milligrams actually, alternate days. And it was continued as alternate days on the 90th day also, because after 90th day that also has tapered off. And her parameters, in effect all the medicines are over by the 90th day. The diabetic medicine, the first day itself. Her blood parameters and diabetic parameters are almost normal. By the 60th day itself, diabetes HbA1c came down, and only the parameter that is not corrected is the AMA. That is autoimmune antibody. If it is the immune system, autoimmune antibody will really need some more time, and some more weight reduction also is needed. Actually, she was in the beginning she was 57.4, and she came down to only by 3 months only 51.4. So she was not overweight, but it will be ideally she should come down to around 50 or even 48 kg to get her autoimmune antibodies also corrected. Otherwise she is okay, and it is very important to maintain it also. So once lifestyle, this clinical support is given to usually for 3 to 6 months. By the time the patient will learn how to manage, and the body parameters will be corrected, and then maintain it without increasing the weight, and to make sure that they're taking the blood sugar also is maintained, and the support is given. And by the 3 months, 3 to 6 months, they'll learn it and continue it. Or if any support is needed, it will be also take the support also to maintain the body parameters correct. Okay. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect and anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins, by improving circulation through optimal stimulation of all cells by plant exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of medicine and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the diseases and the medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about the healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thompson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from the government service, and in 1997 started practicing as consultant at Lifecare Center, Tevara, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us humans, but to all life forms on our planet. Therefore, it is very essential to correct lifestyle, reverse lifestyle disease, and come out of medications to protect our children, grandchildren, and coming generations from the ill effects of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning for surgery for lifestyle disease. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. Reliable and sustainable solution lies in the lifestyle modulation. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with clinically supported lifestyle modulation, etc., you may visit our healthcare channel. Thank you.